We will discuss the top 5 causes of headache, how to identify each cause, and how to treat them. Headache is one of the most common types of pain. It can be classified as primary or secondary. A primary headache occurs by itself without any other underlying condition, like a migraine. In contrast, a secondary headache results from an issue elsewhere in the body. For example, a mild headache during a common cold. Interestingly, the brain itself does not have pain receptors. However, pain-sensitive areas include the scalp, the large blood vessels around the brain, and the layers covering the brain, such as the dura mater. The first and most common cause of headache is the tension-type headache, which accounts for nearly 70% of all primary headaches. This headache is typically a mild to moderate aching pain on both sides of the head. It often creates a tight band or pressing sensation around the head. While the exact mechanism is not fully understood, it is highly likely that tension-type headaches are related to muscle spasms and soreness in the neck and head. Low levels of serotonin also play a role, increasing the pain sensation. The hallmark of tension-type headache is a band-like pain on both sides of the head. The pain does not worsen with walking or climbing stairs, nor is it associated with vomiting, nausea, or visual changes. Common triggers include stress, poor posture, muscle tension, mental strain, lack of sleep, hunger, and eye strain. In some cases, individuals experience chronic tension-type headaches lasting more than 15 days per month. This type of headache is most common in individuals aged 20 to 50 years and is slightly more prevalent in women. Pain can last from 30 minutes up to 7 days. Treatment options include acetaminophen or ibuprofen. Stress management, physical therapy, and regular exercise are essential for long-term relief. In some cases, low-dose antidepressants may be used to prevent headache episodes. Migraine is the second most common cause, responsible for about 16% of primary headaches. Migraine pain is typically more severe and intense. The hallmark is a throbbing or pulsing pain, usually on one side of the head. Migraines are often accompanied by nausea, vomiting, and sensitivity to light or sound, with episodes lasting from hours to days. Migraines can be episodic or chronic, with chronic migraines worsening over time. The underlying mechanism involves overactive nervous cells that trigger blood vessel dilation and an inflammatory response, resulting in pain. Key players in this process include calcitonin, gene-related peptide, and serotonin, which are released due to the nerve cell's hyperactivity. On the other hand, cortical spreading depression plays an important role. This refers to a wave of electrical activation across the surface of the brain's neurons. After this initial excitement, a phase of depression follows, leading to a temporary lack of nutrients and oxygen for the neurons, which can cause symptoms like visual disturbances, nausea, and vomiting. Visual or sensory disturbances that occur during migraine are called an aura. This includes symptoms like flashing lights, zigzag patterns, or tingling sensations. Before these symptoms appear, there is commonly a prodrome phase that occurs hours or days earlier. The prodrome phase includes mood changes, neck stiffness, or food cravings. After the prodrome, there is the aura phase, which lasts up to 1 hour, followed by the headache phase, which can last from 4 hours to 3 days. After the headache, a postdrome phase may follow, in which the person experiences a hangover feeling that can last for up to 24 hours. Also, aura is a classical sign of migraine. It is present in only about 30% of cases. To diagnose a migraine, there must be 5 occurrences of pulsating pain that worsens with movement. There should be associated symptoms like nausea, vomiting, or sensitivity to light and sound. The headache should last more than 4 hours, but less than 72 hours. Migraine usually begins at a young age and is 3 times more common in women. Triptans are considered the gold standard for migraine treatment. Acetaminophen or non-steroidal medications are also commonly prescribed. For prevention, beta blockers or antidepressants may be used. These treatments work by targeting serotonin receptors. acting on the trigeminal nerve to decrease the release of pro-inflammatory neuropeptides like CGRP, which leads to vasoconstriction and reduces pain. The third most common cause of headache is idiopathic stabbing pain. This type of pain resembles a migraine but is not associated with nausea, vomiting, or other symptoms. It is also shorter in duration, lasting only a few seconds and starts unexpectedly. Idiopathic stabbing pain is considered safe and non-dangerous, as it does not cause lasting harm and does not require extensive treatment. The exact cause is unknown, but it may be related to spontaneous activation or misfiring of the trigeminal nerve, which transmits pain sensation from the face and head. The fourth most common cause of headache is secondary to infections. This type of headache is diffuse, dull, or throbbing, and occurs alongside signs of infection such as fever, fatigue, and body aches. For example, common cold, influenza, or COVID-19 can cause headaches. More serious infections like sepsis can also lead to headaches. When the immune system detects an infection, it releases inflammatory molecules called cytokines. These molecules circulate through the bloodstream, reach the brain, and irritate the pain-sensitive structures around it, leading to headache. Acetaminophen or ibuprofen are usually effective for treating these headaches. The fifth most common cause of headache is exertional headache. Exertional headaches occur due to increased blood flow and pressure within the blood vessels in the head during physical activity. Intense activities like heavy weight lifting increase pressure within the chest and abdomen and transmit this pressure upward. This slight increase in pressure within the skull raises intracranial pressure and can provoke a headache. These types of headaches are typically short-lived and resolve on their own once physical activity stops, but they can be intense and throbbing while they last. Other causes of headache are rare but potentially more serious, which is why we will discuss red flags to watch for, which may indicate serious conditions. A sudden onset headache is a significant red flag. For instance, if a person feels fine and then, within seconds or minutes, experiences an intense headache, it could suggest a subarachnoid hemorrhage. This type of headache reaches peak intensity quickly and is considered a medical emergency. If someone experiences extreme pain and describes it as the worst pain ever, this could indicate a brain bleed, infection, or tumor. Another warning sign is vomiting that occurs before the headache, especially if it lasts days or weeks. This can be a sign of increased pressure in the brain and may result from a mass in the brain, such as a brain tumor. A headache that worsens over days or weeks rather than improving may suggest a tumor or a slow-growing bleed. Pain triggered by bending, lifting, or coughing can also indicate increased pressure within the brain. If a headache appears immediately upon waking, especially if it disrupts sleep, it can suggest elevated intracranial pressure, possibly due to a tumor or intracranial hypertension. The new onset headache after age 55 always requires medical attention, particularly if the person was previously headache-free. If a person experiences a combination of fever, severe headache, and feels unusually tired or unwell, this may indicate meningitis or encephalitis, which require urgent treatment. This is especially true if the headache is accompanied by neck stiffness, where moving the neck is painful, especially when trying to touch the chin to the chest. This is a classic sign of meningitis. Confusion, altered mental status is another red flag. The person may appear disoriented, sleepy, or confused. In severe cases, seizures or loss of consciousness can occur. Finally, neurological symptoms like weakness or coordination problems alongside a headache suggest a possible stroke, brain bleed, or tumor, which requires immediate evaluation with imaging tests like a CT or EMRI.